Hello, class. My name is Rashid Roshan. This is my week 6 presentation on my specialty population. The population I've chosen to focus on is individuals with substance use problems. Um, just a little disclosure, I do work in an inpatient dual diagnosis facility that treats both substance use and co-occurring mental health issues. Um, Although we do have a few locations. 75% of them are strictly for substance abuse, while one is just for mental health. So I do have a little personal experience with working with both populations. I've decided to focus on this population for this week's presentation because I've begun to learn a little bit as far as what social workers' role is in this environment, what we do, and how much more we can do to help reach and effectively help this population that is pretty prominent in a lot of Western countries. So without further ado, get started. How is working with the specialty population different from others? So social workers in general, you know, we obviously we have such a big plate of what we can do, right? We wear such a big tool belt, as in we have such a wide range of skills. A lot of social workers work with children, maybe seniors, palliative care, hospice workers, hospital workers. Um, but when it comes to substance abuse specifically, not many social workers do consider themselves experts, at least at the um, obviously, without any kind of in California. I work in Malibu, California. So what some therapists might have is called the CADAC, the California Drug Counseling Certification. But that's in addition to whatever education they may already have. So what I'm really going to be going into is a lot of social workers do feel like, they're not really having that specialty training in identifying substance use and abuse. Um, um, and also just while a lot of there are co-occurring mental health disorders with substance abuse, there is obviously a big difference between substance abusers and just people suffering from mental health issues. Whereas a lot of people believe that, once you remove the substance, the people who are suffering from those disorders that are substance users will no longer suffer from them. Um, so as I stated, I really want to focus on identification and competency as there are two big needs for social workers when it comes to substance abuse. Um, Social workers are more likely to feel inadequately prepared to discuss substance abuse with clients, making it easier to neglect this during an intake. So according to the study that I was doing it on, it was a big population of social workers in England. Uh, about half were working with adult care, so senior care, and half were working with child care. So parents who were who are on social assistance to care for their young children. Um, the challenge social workers may feel is the resistance towards treatment from clients, according to this questionnaire. The questionnaire was an online survey. Substance abuse clients may need some coaxing before accepting treatment for drug issues. This is where like an intervention, for example, might be necessary for certain clients. So a social worker, we know obviously we're not trained specifically. There are certified interventionists. Um, Social workers are more likely to feel inadequately prepared to discuss any kind of substance abuse, and so a lot of times they just avoid it in general. So even if they do suspect it a little bit, a lot of people, according to this survey, were just reporting that they were kind of glossing over it and moving on to the other parts of care for the relevant clients' treatments. Um, so according to the online survey, social workers had a difficult time assessing what constituted substance abuse, and over one-third found it very difficult. Social workers can work with adult or children populations, but what this questionnaire found was for adult care social workers, uh, they identified substance abuse as if it regularly affected their ability to undertake activities of daily living over and above the physical disability. Where for child social workers, they identified substance abuse as whether it impacted their ability to be a parent and meet the needs of their child. So what I wanted to highlight there was the they're not on the same page, these two categories of workers, as far as how they can identify substance use among any individuals, because they really catered it to specifically the client population, and they didn't really focus as much on substance abuse in general. And an additional questionnaire found that social workers reported that the use of substances, along with the effects of and reasons for substance use, were among the topics they found to be covered least during their education. So again, this is where the lacking of confidence and competency in this area is really plaguing social workers in this England study. So how would you, as a social worker working with this group, prepare to address such needs and challenges? Um, so first of all, I mean, although social workers don't, they're not going to prescribe medication. It's very clear they must obviously inform the client of what their role is going to be. Um, they play an important role in assessing clients' current and past substance use, intervening to support clients' pain management strategies, assessing clients experiencing problematic substance use, referring clients for additional services and self-help programs, and collaborating with the entire treatment team. So this is where the collaboration aspects are pretty key. Um, I put informed eclecticism because different hats might need to be worn for different clients. Obviously, this goes into the process through which social workers and other service providers should approach making decisions about which models employ to help people effectively. So one model might not be effective for all regarding substance use. So the resources I would need as a social worker off the bat, I would consider implementing treatment that is evidence-based, comprised of clearly described strategies and techniques consistent with social work ethics within the social worker's competencies and that are culturally relevant. Relapse prevention strategies would be my go-to, and they would be discussed in a manner that exposes addictive behaviors as overlearned habits. So helping them analyze and modify their behaviors and any other relevant habits, and I would lead an examination of the factors that led to substance abuse, and along with social and family environment, observations of peers and family members using substances, along with the consequences from the use. I lead a family systems theory group in the rehab I work at, and I'm constantly pushing the role of family in substance abuse to clients, and I do find that very relevant. Another technique would be motivational interviewing. So really to help build some autonomy with the clients and understanding their motivations of whether and how deeply they do want to abstain from substance use. So the resources the clients could benefit from being educated from a variety of resources and tools. Some clients may need that kind of confrontation. So this is where like an intervention would be helpful for a lot of clients. But even if you don't have to be, maybe not an intervention, but some kind of more somewhat aggressive method of case management could be necessary for certain clients who are facing that life or death situation if they're not um, abstaining or ready to be abstinent from drugs. Other clients may benefit from like feeling in control, so that's where like motivational interviewing can be utilized, and relapse prevention tools will be extremely helpful for clients to know of and use the when applicable. I've listed recovery meetings here on this slideshow, as you see, because uh, they could benefit from this. A lot of obviously there's a lot of research now that shows how helpful is incorporating a spiritual component and then also just the general cohesiveness AA brings to people. But social workers must be prepared for clients who are against a spiritual aspect and don't want to incorporate that into the sobriety. So last but not least, the way I can distinguish my role would be to understanding the signs and symptoms of substance use, because this is a very, very relevant uh, you know it's a very, very relevant treatment in our field. Understand, not not making not making a confrontation out of it, but just really just assessing it and bringing it up to the client's attention. If I do have an intake that I might suspect would is abusing substances, it is my duty to really bring that forth and bring it onto the table. These are my references. That's about it. Thank you very much for listening.